Well, we found out we were pregnant. We'd been trying for several years, and we were very, very excited. We did know that that I had a heart problem, but I figured I'd just breeze through it anyway. And so we did make an appointment with a doctor and went in to confirm the pregnancy test and whatnot. And boy, she took one listen to my heart, and she referred me on to St. Al's and some specialists there. We did a lot of the diagnostic tests on my heart with Dr. Ryder. He and Dr. Bobrowski really managed the critical aspects of the pregnancy. I had aortic stenosis and mitral valve stenosis, which means that my heart was damaged when I was little. I was probably 6, and I had rheumatic fever, which will attack your heart valves. The effects of that are that you're constantly tired. Just the effort of getting up out of the chair and walking into my kitchen would leave me breathless because my heart couldn't physically pump enough blood to keep my muscles oxygenated. The day before I was scheduled, they started the induction that night, the night prior, and we walked up into the ICU, which was the most surreal feeling, knocking on the door of the ICU to go check in. And we walked in, and there was IV pulls all over, every medication that I could possibly need. Anything that went wrong was already strung up and waiting on the IVs. So they put, my goodness, I had, I think, 4 or 5 different ports on my arms, in my arteries and farther up on my arm, and just so that whatever medication I needed, it would be there and ready, and they could do it instantly. So they induced me. Labor went well overnight, and then it started to pick up, and first thing in the morning, they broke my water, and I labored most of the day, and then I think it was around 1 o'clock, 1:30 that afternoon, my heart and Kyle's heart, my son's heart, they both started kind of going where they thought I was getting into touchy ground. So we ran. They literally threw everything on the bed, and everybody ran down the halls and into the cardiovascular operating room. The thought was that my heart was going to quit, and I'd have to go on the heart-lung machine, onto life support, and possibly do the valve transplant that day. My husband said he counted, and there was between 20 and 30 people in the room just standing by waiting. So we had people from the NICU for my son when he was born. We had the cardiovascular team. We had the obstetrics team, the ICU team. It was just amazing. Kyle was born right around one of the shift change times, and so we were told, I didn't see it, my husband didn't see it, but we were told that people would clock out because they had to, and they'd be replaced with the new people in the room with us. And the people that had clocked out, they all came back in, and they all stood in the hallway outside waiting for his birth, waiting to see the outcome, which we thought was just super. We thought that was pretty neat. My nurses, they were great. They loaded all of because I was still on a bunch of monitors for my heart and everything, so they loaded everything again up onto the bed and pushed me from the ICU all the way over to the NICU. And my husband was so sweet. He had kept everyone from holding him, other than medical staff. My husband didn't even hold him until I got there, and then I got to be the first one to hold him. That moment was just amazing. There just aren't words to describe how wonderful it was to hold him and to know that, we still had some challenges ahead of us. We didn't know how my heart was going to act, but to know that he was fine. We had done it. Honestly, there isn't a day goes by that, especially when I'm rocking Kyle to sleep, naps or bedtime, that I don't just send out all my thanks and gratitude to everybody that was involved, because this isn't just me. This isn't just something I did. It wouldn't have been possible without the team that had been put together at St. Al's and without my family. The amount of energy that they put into my care and my case made that critical difference. We had the best outcome as opposed to the worst outcome, but we were prepared for the worst. After I had Kyle, I was determined. I'm fairly stubborn, and I was determined that my heart was fine and nobody knew what they were talking about, and I was just going to go on with my life, and I was done. right? And so I noticed that I was more short of breath and more tired, but I didn't become worried until that I started having these attacks of angina. And let me tell you, if someone does they were intense. We were on a camping trip, my hands and knees on the floor in the camper, just sweat dripping off of me and just panting, trying not to yell out. And I don't typically yell with pain, but I was trying not to yell out because it feels like your chest is just going to crush. Everything is just seized up in there. Well, he got rather upset with me and took me back to Dr. Ryder, who also got upset with me. And within 2 weeks, I had had the open heart surgery. We met with Dr. Hurd, our surgeon, and he said, well, how did he put it? It's not an urgent issue, but we need to have it fixed. And when he said that, I thought, I've got a couple of years. And he said, so sometime within the next 6 weeks or so. And you think, if your heart surgeon is telling you it's not urgent, but it has to be in the next 6 weeks, probably is fairly urgent. Without Saint Alphonsus, we wouldn't have our son, and I am firmly convinced that without Saint Al's, he or I or both of us wouldn't be here. So we think Saint Alphonsus is pretty tops around our house.